COVID's dreaded second surge. It is here. It is very real. Local hospital officials warning tonight it could continue to get worse. Our Robbie Owens spoke with the CEO of Texas Health Resources earlier today about what they describe as the critical weeks ahead.
I don't think we anticipated it being this long.
Frustrated, worried.
Doesn't care how old you are.
And just about worn out.
I get home and I have nothing to give my family.
It is not an exaggeration to say every single day we find frontline caregivers, whether it's nurses or doctors or respiratory technicians or anything, crying in break rooms.
Now there's a new plea to take precautions from the pandemic's front lines.
We're exhausted. And when we look at where we are right now, and then we look at what might happen through Thanksgiving and Christmas, I don't know where it'll end.
Barclay Burdan is CEO of Texas Health Resources. He says the number of COVID-19 patients and those under investigation in their hospitals have increased almost 75% over the past 4 weeks.
I chatted with a couple of nurses a few days ago who had a terrible day. That day they had 5 patients in their ICU die, and they were heartbroken.
Wearing masks, washing hands, and skipping the large gatherings, he says, a small price to pay.
What we're actually trying to avoid is more shutdowns.
Because in spite of Governor Abbott's assurances, COVID hospitalization numbers higher than 15% for 7 consecutive days could lead to just that. Burdan says we are now on day 2.
His executive order in place is automatic if we go those 7 days.
You understand that people are tired, but you also have the perspective of seeing the consequences of us getting tired.
That's absolutely correct, Robbie. The consequences are dire. I want people next year to be able to visit their family members as well.
Robbie Owens, CBS 11 News.
That hospital CEO, by the way, also shares that, yes, the vaccine developments are encouraging, but those vaccines will only be available in relatively small quantities over the next few months. His worry is that COVID is going to explode over the next 2 weeks.